I'd like to now introduce Dr. Paul Mittman, who is our President and Chief Executive Officer of the Southwest College. He has been a good friend of mine and a colleague for many years. He's a 1985 graduate from National College, and in the colorful history of our school, he is the point of our arrow and a driving force as he advances our school and the naturopathic profession. We, the college, are here and are as successful as they are because of Dr. Mittman's tireless energy and vision. So please join me in welcoming Dr. Mittman, who will be delivering the presidential address.
Thank you, and welcome to our friends, our families, and all the people who love and support this incredible class of 2010. Before I get started, I do want all of the people who are friends and supporters and family members and loved ones for you to please stand up so that we can recognize you. I was working out this speech, and it's easier for me to write and move around at the same time, and so I went for a bicycle ride, and an interesting thing happened, which I ordinarily refrain from any self-referential remarks, but it was too good to sort of pass up and kind of too unusual, and somehow I was able to weave some of the principles of naturopathic medicine into this, so I hope it's of some value to you. I was riding my bicycle out by Usury Pass on the Bush Highway, and noticing that it was kind of a buggy day, I thought I should keep my mouth closed, just sort of joking. And about halfway into the ride, about 20 miles into the ride, so I'm all the way out, kind of in the middle of nowhere, a large insect flies into my mouth. I'm thinking, what is that? And then I could either hear or feel the buzzing in my mouth, and then yow, or some other four-letter word, and I realized that I was being stung on the roof of my mouth and on my tongue. So I asked the class, the first order of business for a naturopathic patient is to do what? Is to remove obstacles to cure. So the first order of business was to get the bee out of my mouth, which going, full speed was a little bit of a trek. I spit it out. And then the next thing is all of the history, physical diagnosis, pathology comes into play. And so the first thing that you would ask a patient in a circumstance like that would be, do you have an allergy to bee stings? Which I didn't, although you never know. It could be the first time for everybody. And so I thought, well, the next few minutes will sort of tell the tale. And I'm out in the middle of nowhere anyway, so there's no point in turning around. And if I need to, I hope maybe I'll have to, if I have to, I can flag down a car. And so after rinsing my mouth out, I realized that, without an EpiPen, that, our own bodies produce a significant amount of our own adrenaline, which is our epinephrine. And so I was pretty worked up over it and ended up riding back. I think it was the fastest ride that I ever had. And it shows that owing to our homeopathic principles, that a little bit of something can be beneficial, but too much can be harmful. And so the talk that I was thinking about had to do with a quote that politicians and scholars, usually historians, like to cite. George Santayama's quote, who said, "Those who cannot remember the past are condemned to repeat it." And so I ask, why is it always invoked as an admonition against repeating past mistakes? Because our past is also filled with successes. And this is particularly true for you. As young physicians, you'll build your practices on the foundations laid during these past 4 years. And so I recommend that you do, in fact, remember the past and honor it and grow from it. Today, your memories of these 4 years dominate your minds. You've taken a numbing number of exams and quizzes, performed countless histories, physical exams, and have been bombarded with tens of thousands of bits of information ranging from the most minute details of biochemical equations, action potentials, botanical and pharmaceutical indications, contraindications, and adverse reactions, homeopathic particulars and homeopathic generals, hundreds of individual acupuncture points, IV calculations, lab values, to name a few. Yes, we made sure that your time at SCNM was anything but dull. Over time, however, the overwhelming majority of these data points will in fact fade from your consciousness. They'll still be there. You'll either have incorporated them involuntarily into the routines of your practice, or they will lurk in the recesses of your minds, waiting to be recalled when patient care requires them. The persistent, vivid memories, however, will be of people and of events. These too will be sanded down and polished over the course of time, leaving only isolated remnants in your consciousness. For our faculty, it'll be a story or two, some wise remarks, or kind, encouraging words. For a few of us, we'll evolve into caricatures that you'll laugh about and tell stories with your friends at the 2030 AANP National Convention. Your relationships with your classmates, a deep emotional reservoir today, will endure even as you move apart. Your most valuable experiences, I assert, are those with your patients. For it's those successes that will guide you and inspire you far into the future. As students, these outstanding young physicians have already helped thousands of patients. They've treated women and children struggling with the ravages and emotional scars of abuse at a women's shelter. They help men and women recover from the after effects of substance abuse. They treated the homeless and the working poor. They were the sole source of health care for the 2,000 children in the Murphy School District, one of the poorest communities in Arizona. And most importantly, they've helped many, many people with the chronic diseases that are plaguing our society today, with diabetes, with heart disease, with cancer, with hypertension, with gastrointestinal diseases. Some of these interactions were mundane, a flu or an earache. Others were more profound and life-changing. 1 week ago, a student forwarded me an email from an elated patient whose triglycerides dropped over 500 points in his first 6 weeks under her care. Some of you actually helped a close friend of our family. The brother of our son's girlfriend was diagnosed with a debilitating rheumatological disorder. You know, one of those syndromes that don't have a clear cause but can be treated somehow with steroids. After a thorough evaluation at Mayo, he came to our center and was treated by one of our physicians and you. Today, his joint pains are but a memory. He regained the 30 pounds and just completed his college education. All by eliminating gluten from his diet. Despite the remarkable clinical results, for some reason his gastroenterologist says that the tests are inconclusive and disputes his need to stay on a gluten-free diet. Our patient, however, knows better. I can cite many, many more examples. In fact, some of your patients are probably here in the audience today. They're here to honor you and to share this wonderful day. They stand as a testament to your dedication to the healing power of nature and to the principles of naturopathic medicine. Hold fast to those principles, for they are beacons of light for even the most difficult cases. And please remember that the college, your teachers, and all of us will always be here for you. We will be thrilled to learn about and to share in your successes, and just as eager to lend a hand should you ever need our help. Congratulations, and God bless.